think one of the things that we sort of stress with all our patients who come in seeking rhinoplasty, and I'll give you a lot of credit with respect to this, is the idea of support for the tip. A lot of patients come in and say, well, how do I avoid having to have this done again? They understand that nationally, if you look at sort of the literature, revision rates are close to 15–20%, and they say, I don't want to go through that. What do I have to do, or what do you guys do to avoid that?
Yeah, because we do so much revision, it's about half of our practice. I think over the years we've gotten a really good sense of, well, what are the reasons for revision? And in a lot of patients it's because they lose support over time. And it may be a year or 2 years after surgery, maybe several years after that. But really one of the key factors we find that's, and we've applied in our own patients, is you have to provide real structure. Because at the end of the day, when it's done right, rhinoplasty should really be a once-in-a-lifetime procedure.
Yeah, let's be real clear. When Dr. Lindner says 50% revision, we're talking of other people's work. Our own revision rate obviously is in that 1–2% rate, and I credit that largely to the idea that, you know, probably the number one reason people ultimately 2 years, 3 years, 4 years out, something happens to the tip where it either distorts and falls or turns, largely due to lack of support. So we have largely moved away from an idea of sort of putting struts. We've always sort of been suspect about whether that works. We'll talk to you about what the other options are, whether that's a tongue and groove, whether it's a septal extension. How we do that will differ depending on what we're trying to accomplish aesthetically with you, but it's really, really important if you're sort of saying, I don't want this to be like an annuity, I don't want to have to do this over and over again. You have to talk to your surgeon about what the revision rates are, what the policies around that are, and what do they do to avoid that.
And Dr. Solomon mentioned a couple of techniques that we use very often for tip support. To kind of give you the big picture, really two really important things. One is surgeons that largely rely on making tips smaller, more delicate by removing a lot of the tissue of the sides of the tip. Those are really generally bad ideas. They may be fine at the beginning, but over time that's what leads to lack of tip support over years, and that's where you can get pinching or twisting or other things that really should never happen after rhinoplasty. The second has to do with creating some better tip support, even for people who have all their insert cartilage there. Columnar struts, which you heard about, a lot of surgeons do use. We find that they've proven to be less effective over time, and so we use other techniques. But the large and short of it really is you have to provide something that's going to anchor the tip to the septum behind it so that over years it's going to maintain that rigid support and not fall or twist or create problems.